All right, speaking of Europe, they are starting to ease some lockdown restrictions. Restaurants, bars, salons, and other shops are reopening in Italy today. Spain is also lifting measures as the daily coronavirus death toll drops to record lows in both countries. Church services have also resumed with strict social distancing rules in place. However, there are still concerns about a second wave slamming Europe as countries continue to ease those restrictions. So for more on this, let's bring in Charlie D'Agata. He is following the latest in London. Charlie, good to see you. So we know lockdown rules vary from country to country. Take us through some of the latest developments, especially in nations that have been hard hit like Italy and Spain.
Well, you know, Vlad, we look to Italy and Spain because they were hardest hit. The UK has now climbed to the top of the leaderboard there, unfortunately, but they were first, too. So we look at their easing up of restrictions. What's happened in Italy, as you said, church services have resumed. You know, priests are wearing masks and gloves to give communion. Some of the cafes and hair salons are opening. I wish that was the case here. In Spain, some of the hotels are opening, some of the cafes are opening, but they have the social distancing and they're not allowing people to sort of gather in those common areas that you would normally see in a situation like a hotel. In Germany, the cafes have opened over the weekend. Importantly, their beloved, Bundesliga, their football, their soccer has begun again, but those have been played at closed stadiums. Here in the UK, it's kind of been ambiguous. There was an announcement a couple of days ago where they said, where Prime Minister Boris Johnson said some of the people who cannot work from home should now start going to work if they have to. And if there are certain precautions that are in those offices, but that wasn't really a sort of determination that it's been called the DIY government, where people are saying, well, are we supposed to go back to work or not? I can tell you largely from experience, the roads are still empty. Most of the people are staying at home. There's definitely a fear of going out now. And at the same time where they're saying you should go back to work, they're saying try to avoid public transport, which is difficult for people who obviously rely on public transport in order to get to work. So there's been a lot of concern and frustration, from my own point of view. My family, just over the weekend, my daughters were able to see their friends for the first time in 8 weeks, but only one friend and only at a distance. Even people that want to see, say, their parents, people of my age who might want to see their mother or father, in theory, you'd see your mother in the morning and your father in the afternoon. You can't have a gathering. So little by little, there are baby steps where they're trying to introduce this while not having that rate of infection go up again. And that's why we're looking especially at Italy and Spain, because they're a couple of weeks ahead of the curve. Their peak has come down. The UK, that's happening still. And we're going to see an easing of restrictions here and in the United States.
So in the meantime, Charlie, Angela Merkel of Germany and Emmanuel Macron of France are expected to speak in front of the WHO. What do we expect to hear from them? Germany seems to have done quite well with the coronavirus testing very, very early. France has a very, very high death rate.
Yes. Well, there are two things that are happening. First of all, they both will be addressing the WHO. We understand that they will both be talking about more funding for the World Health Organization. That was not the case in the United States, so they're putting their support into the World Health Organization. That's one part of what's going to be happening this afternoon. In addition to that, there's going to be a joint statement, this Franco-German statement, where they're going to have a plan for Europe. It's going to be unveiled a little bit later this afternoon, and on the line is about $550 billion worth of emergency funding. Where this becomes really difficult is you've got 26 countries in the European Union, formerly 27 before the UK Brexited. But each one of those countries is facing its own challenges. As you said, Germany has been very effective in tracking and tracing from the very beginning and have been able to keep the numbers down. France, that wasn't the case. Certainly here in the UK, it wasn't the case. But it's also the impact on the economy. And the countries, similar to the situation in the United States, where the governors have got the decisions as to how they're going to reopen and when they're going to reopen and at what kind of pace. You have, say, Greece, for example, who they've started to reopen their beaches. Tourism is such a big deal there. They don't want to have that impact. But there's not a sort of broad policy because each country has been affected differently, and each has its own set of problems economically. Interestingly, some of the Eastern European countries that are part of the EU have been less affected. Part of that has to do with the fact that they reacted very quickly in the beginning in testing and tracing, and also due to the fact that, places like Romania are not going to be impacted like here in the UK, where you've got lots of international travel, or Germany, where you've got essentially a European hub and lots of movement in and out of those areas.
You were talking about the UK, Charlie. I must say that you do cut a very handsome Leonine profile with your hair. I know there have been protests in the UK, so no need to worry about that. But I also want to ask you about Sweden's decision to stay open and not enforce strict lockdown restrictions. There's new data that shows the coronavirus outbreak has been much more deadlier than neighboring countries. So break it down for us, because there are some in this country, including politicians, who have pointed to the Sweden model as perhaps one that should have been embraced by the United States. But this new data suggests otherwise, and there's a huge difference in the healthcare model that Sweden employs versus that here in the U.S.
Yes. Vlad, we could talk for an hour about Sweden. We've been fascinated by it here in the UK. We understand that people in the United States have been looking at it and say, look, they didn't have this nationwide lockdown. You have to be careful of statistics. First of all, yes, their numbers, especially their mortality rate, is far higher than their neighbors, places like Norway and Denmark. But they are lower than places like France and the UK. So you can't just scribble that off. In addition to that, you've had Swedish politicians saying that anybody that would be looking at the so-called Swedish model would think that it's a free-for-all. They did encourage, right from the very beginning, social distancing, the same sort of things. Work from home if you can work from home. They just didn't impose it. They didn't close down the entire economy. So economically, they have been able to recover because they didn't really go into a nationwide lockdown. In addition to that, it really has to do with how close people are together. Outside of Stockholm, Sweden is fairly spread out. But when you've got hubs like New York City, or you've got hubs like London, and hubs like Paris and parts of Germany, then you're going to have a high infection rate. You don't have that kind of similar situation in Sweden. However, did it work? I hate this phrase, but only time will tell, because the pandemics were all based on numbers and data. And as the data continues to formulate over the next few months, they'll realize whether the Swedish model, which, let's face it, was a gamble, was worth it. In the short term, they're right about medium, which is to say, would there have been value in not shutting everything down? Or if you get a place like the United States, which is so immense and huge, could you have had certain areas where there was sort of spacing, which is, by the way, what they're doing in Spain and France? In this phase two, they're reopening places that are less populated, less densely populated, because there isn't as much of a risk of that, the second wave. So I think that's where Sweden is fascinating, but you can't draw, there are no single black marks you can say, well, that worked and that worked, because there are too many moving parts in the Swedish model.
Yeah, you know what? I'm really glad that you clarified that, Charlie, because the impression when people talk about the Swedish model is that it was kind of like they never changed anything at all. And they actually did very clearly ask people to modify their behavior and to distance themselves and do a lot of the things that you're seeing here. So it wasn't exactly, just let the herd take care of it. Not at all.
No,
Charlie D'Agata,
not at
thank
all.
you so much.
Thanks, guys. Stay sane.